Have you ever sat down to eat something that you thought was healthy and thought, why does my jaw feel like it's running a marathon? Here's the weird part. Sometimes it's not the chips, the steak, or the gum that gets you. Sometimes it's the salad. And that sounds ridiculous. But if you have TMJ pain, clicking, clenching, jaw fatigue, healthy foods can feel like some of the hardest on your system. Today, I'm going to show you which foods secretly punish your jaw, how to modify them without living on mush, and how to get back to chewing normally. Because yes, you do want to do that long term. Think of your jaw like it has a daily budget. On a good day, you can spend that budget on talking, stress, posture, chewing, maybe some clenching that you didn't even notice. But on a flare day, your budget is tiny. And however you still want to do a full price meal with a full price chewing, your jaw goes into overdraft. That's where we get jaw fatigue, headaches, facial tightness, tooth sensitivity feelings, and sometimes that I can't open properly stiffness. So the goal isn't to stop chewing forever. The goal is to stop overdrafting your jaw while you're healing. Most people assume hard to chew means hard food. But the jaw doesn't care if it's hard or soft. The jaw cares about workload. Two big workload drivers are. First, resistance. Things like steak, jerky, crusty bread, thick bagels, chewy candy, dried mango, anything that fights back. Second, repetitive grinding. This is a sneaky one. Leafy greens, fibrous foods, thin foods that don't break down. Those force your jaw into a long, repetitive grinding pattern. But here's the kicker. Prolonged light grinding can be just as aggravating as one hard bite. Let's talk about salads and leafy greens because honestly, they're the classic, I'm doing the right thing, jaw flare-up. Most days, it takes me half an hour to eat my lunch salad, sometimes longer. Not because I'm enjoying it, but because my jaw is negotiating terms and conditions with every bite. And it's your great examples. They're thin. Your teeth get close together and you end up grinding them a lot to break them down. In kale, it's fibrous. It can feel like chewing a phone book page that refuses to become a swallowable bite. Here's some short-term solutions for your acute jaw pain days. Cut everything very fine. Small pieces equal fewer grinding cycles. Chop against the grain or fibers. You're pre-breaking the ropes so your jaw doesn't have to. Soften first. Saute, blanch, steam, blending. Smoothies are a very safe option when your jaw is irritated. You can still get nutrients without paying the chewing tax. And I want you to hear this clearly. Choosing a smoothie on a flare day isn't giving up. It's smart load management. Now let's expand beyond leafy greens because salads are only one category. Chewy, springy foods, category A. These are like resistant bands for your jaw. Think things like bagels, crusty bread, pizza crusts, steak, jerky, ribs, gummy candy, taffy, thick tortillas, and dense wraps. Try swapping those out with jaw-friendly foods. Choose softer breads. Sourdough can be easier than dense bagels. Fresh bread, easier than toasted. Make proteins tender. Slow cooker, braising, ground meats, flaky fish. Cut meat across the grain and into smaller pieces. Skip chewing gum for now. If you clench, gum is like giving your jaw a part-time jaw it did not apply for. However, if you notice you chew on one side more, these foods will amplify that imbalance fast. Category B, crunchy and crack foods. The jaw hates surprise resistance, especially if your bite isn't perfectly aligned that day. Think about biting into these and see if you can recognize them as hard. Raw carrots, raw broccoli stems, nuts, trail mix, chips, popcorn, granola, hard crust, toast and crackers. Instead, consider jaw-friendly options. Cook crunchy vegetables, roast carrots, steam broccoli, and saute peppers. Use nut butters instead of nuts. Choose softer snacks like yogurt, hummus, soft cheeses, oatmeal, and chia pudding. If you love crunch, I get it. Use the crumb strategy. Crush crackers or nuts and sprinkle lightly rather than chewing full pieces. But be careful with popcorn. Kernels are not just chewy, they can irritate teeth and trigger protective clenching. In my Simply TMJ courses, I teach practitioners many different aspects of helping someone with jaw problems, including food scheduling. Ask your person to upgrade their skills so they can help you out. The link's in the description. Category C, small and hard foods. These are the tooth breakers. These are the foods that demand precision and can provoke guarding. Ice. Please don't eat ice cubes. Hard candies. I know, you'll just let them melt, but will you? Unpopped popcorn kernels. These are killers because you often don't know they're there until that handful of popcorn hits your mouth, and then it's too late. Just eat 1, 2, or 3 little kernels at a time and make sure you don't get that nasty surprise. Very hard nuts. Go with something softer like a walnut or a cashew. The easiest solution is to avoid these, especially during flare-ups. If you need something for dry mouth cravings, use lozenges that dissolve and don't tempt the chewing. Category D, wide open bite foods. This is huge. A lot of TMJ flare-ups aren't from force, they're from jaw position. You know the ones, tall burgers. Why make it 2 patties tall and not just wider? That would make more sense. Big sandwiches, oversized apples, corn on the cob, thick subs, and stacked foods. To counter the tendency to open your mouth too wide, try these strategies. First, cut your food in half, then cut it again if necessary. Consider making open-faced versions of your meals. For fruits like apples, slice them into smaller pieces, and for corn, shave it off the cob. Opt for smaller bites to avoid forcing your jaw into a wide open position. Think of it like this. If your jaw is already irritated, a big bite is like forcing a stiff door hinge open and expecting it to feel better. Category E, sticky foods. These pull on the jaw and teeth and often trigger clenching. These are gummy things like caramel, sticky candies, dried fruit like dried mango and apricots, or thick chewy bars. For a workaround, swap to softer fruit, ripe banana, berries, melon. If you want dried fruit, chop it tiny and mix it into yogurt or oatmeal. Choose softer snacks during your acute phase. But we do not want you to be stuck on soft foods forever or even for too many months. Chewing is normal. Chewing maintains muscle strength and coordination, joint nutrition through movement, and normal nervous system mapping of the jaw. For children, chewing more challenging foods help to build strong, well-developed facial features and teeth alignment. So here's the framework. During the acute flare phase, which typically lasts a few days to a couple of weeks depending, if there's bony remodeling of the condyle, it can take 6 weeks on soft foods. Your job is to reduce irritation and stop overdrafting your jaw. That means modified textures, smaller bites, and less grinding. When we get to the recovery phase, you gradually reintroduce chewing like you've reintroduced walking after a sprained ankle. Not running 10K, but by adding controlled, manageable load. However, if you've been on soft foods for a long time because chewing feels impossible, that's not just a food issue. That's a we need assessment signal. Here's a simple progression. Adjust it based on your symptoms. Think, I should feel worked, not wrecked. This is for educational purposes only, and you really should talk to your healthcare provider. Modify the texture, reduce the grind, keep your nutrients up, and then rebuild chewing capacity gradually. Step 1, think soft but still chewable. Scrambled eggs, flaky fish, well-cooked rice or quinoa, soft pasta, cooked vegetables, and ripe fruit. Step 2, medium chew. Ground meat, meatballs, soft chicken in small pieces, steamed veggies with some bite, soft wraps, not dense, cut into small sections. Step 3, we're back to our regular living or normal chew. Salads, modify them first. Firmer proteins and crunchy foods in moderation. Follow this rule of thumb. If you feel increased pain, fatigue, or next day tightness, you progress too quickly. Back up one level for a few days. And one of my favorite quiet wins is simply reducing chew time. If a meal takes you 35 minutes of chewing, that's not nutrition. That's jaw cardio. We want efficient chewing during recovery. If you haven't been able to eat anything but soft foods for a long time, or you have consistent jaw locking, open or closed, escalating pain, new bite changes, tooth pain that hasn't been properly assessed, or symptoms that are spreading into headaches, neck, ear pressure, you should be assessed. A TMJ informed manual therapist can be helpful. A massage therapist, physiotherapist, or osteopath, depending who's appropriately trained in your area. And you may also need to see a dentist to rule out tooth pathology, because sometimes what feels like jaw pain is dental, and sometimes what feels like dental pain is actually jaw muscle pain referral. But the key is this: you do not have to push through chewing pain as if it's a character building exercise. If your jaw feels tight right now, this is the video you need to help it relax. So if salads, kale, bagels, or crunchy snacks are flaring your jaw, now you know why. It's not that those foods are bad, it's that your jaw is temporarily underfunded.